COVID numbers are rising, and the Easter weekend brings with it the temptation to celebrate with families. Niagara's acting medical officer of health, Dr. Mustafa Hirji, is urging us to avoid these get-togethers. Dr. Hirji, with more than 500 active cases right now in Niagara, is it time to sound the alarm?
I think it's absolutely time to be sounding the alarm. We are heading, as you say, into the long weekend, which in normal times would be the time where we would gather, spend time with extended family, friends, and really enjoy others' company then. I think after a year of being starved from that, everybody really wants to do that. But unfortunately, I just don't think we can do it quite yet. I think we need to hold out a couple more months, really get some more vaccinations out there, get to the heat of the summer, and then we'll be in a safer place where we won't have to worry about a third wave coming on, because that's what we're seeing right now.
If you have elderly parents that have been vaccinated, is it safe to have them over?
Right now, we're only giving people 1 dose of vaccine rather than the full 2 doses. And regardless, even if they had 2 doses, a vaccine is not 100%. We are seeing people who have been vaccinated getting sick with COVID-19 once in a while. So I don't think it's safe. It's obviously much safer than for people who are not vaccinated, but the way we're going to be safe to start to gather again is when most of us have all been vaccinated. So, the little bit of risk that we all have is all spread around, and it makes it safer for everybody.
With some recent nice weather, we've seen tourists flock to Niagara Falls, booking hotel rooms. Niagara-on-the-Lake has been busy as well. How can we avoid another outbreak if that continues to happen?
That makes it very challenging when we have large influxes of people coming in from elsewhere. And potentially, I've seen some of the photos, people are not keeping their distance, which should be the first thing they should be doing in order to stay safe. What I'd really recommend for everybody is to stay away from being near those crowds, so at least we stay safe from it. We obviously need to continue to discourage people from doing that. That's exactly the kind of social activity and non-essential activity that we unfortunately need to be avoiding for a little bit longer.
Would you like to see Niagara aligned more with Toronto on the color-coded system?
I really feel that we need to have the entire Golden Horseshoe all aligned on the same system. What we've seen is that when regions like, Hamilton is moving to lockdown recently, that happened to them in December, and that didn't lead to their cases coming down. Peel and Toronto, we've not seen their cases coming down while they are in lockdown. It's only when we all as a group go into a lockdown together do we really see our numbers come down together. So I really feel we all need to be, as one big unit moving together through the system.
We've also seen the numbers increasing amongst younger people, especially with the variants. We've seen schools across the province as well, the numbers rising there. So these variants are really complicating matters.
They absolutely are complicating matters. It does seem like they are spreading a bit more through the younger groups. That is the group where we see more social interaction, so that might be part of it. The other part is we're fortunately not seeing the 80+ group getting sick nearly as often. And a big part of that is that so many of them are vaccinated. In Niagara, 74% of that 80+ group has had vaccine. So that means when we're seeing, 68 cases we're seeing today, it's more concentrated in those younger groups because we've taken out that oldest group from it. And so we're seeing more infection there. And unfortunately, we are seeing hospitalizations, we're seeing ICU admissions in that age group.
We've only had just under 10% of Niagara's population vaccinated. And you talked about ICUs being overtaxed. And I've heard the statistic today that we are at higher levels of ICU admissions across the province than we were even at the beginning of the pandemic.
We're definitely at higher than we were at the beginning of the pandemic. I think what's really notable is that there's more people with COVID currently in the ICU in Ontario than was at the peak of the second or the first waves of the pandemic. So it's really, the worst possible time. You mentioned our vaccination coverage, and we're actually up to about 13.3% of our Niagara residents now have been vaccinated. So that number is fortunately rising relatively quickly. We just need to hold out for a couple more months so that number can be really quite large and be large enough to protect us. And that means I think we do need to hunker down for just a couple more months to get out to the month of May, and then I think we'll be in a much safer place.